Welcome to the Chad G. Ortho OT Podcast. I'm your host, Chad Guerrero. I'm an orthopedic occupational therapist, strength and conditioning coach, sports trainer, and I hold over 40 specialty certifications in manual therapy, orthopedics, and sports medicine. On this podcast, we will discuss everything orthopedic therapy, sports medicine, and more. If you're a therapist, health and fitness professional, or someone just wanting to learn more about the orthopedic and sports medicine world, then this is a podcast for you. Let's get started. Hey everyone, welcome to this episode of the Chad G. Ortho OT Podcast. Today we're going to talk about, rotator cuff pain or possible rotator cuff tear. You're at home and, you've been having some shoulder pain and, how can we try to figure out what's going on? What's some stuff you can do at home to kind of check and see? And then, what's the worst case scenario? If you have to have surgery and things like that. So I've been taking care of rotator cuff injuries and pathology for the last 18 years of my career. And, they really vary with severity. They vary with, complexity. And then, of course, everyone's prognosis, is always different. Everybody's is a little different. So, a lot of people, you kind of have two ways. Or a lot of people, they say, well, I don't really know of anything that I did. Just woke up one day, my shoulder was kind of sore, thought I slept funny, or something like that, or maybe the day before they're outside playing in the yard with the kids, or just whatever, and the shoulder's gotten sore, and then it just continues to get sore, doesn't really get better, having trouble sleeping at night, those kind of things, and so that's kind of one way that it comes on, just kind of slow progression, not really sure, can't really pinpoint one particular thing. And the other would be something traumatic. You fell, you were in a car wreck, or you're catching yourself from falling off a ladder, or, something like that. You got it yanked or pulled on the, your arm, those types of things. So something more traumatic, which in those cases, obviously, you're more likely to get that checked out and then, looked at by a physician or someone right away. You're not going to let that rock on and be like, well, I'll probably just work through this and it'll get better. So that's kind of the two ways that this happens. So kind of going back to the just what is the rotator cuff? I've heard all kind of things in my career. I've heard people say rotary cup and all sorts of things. It's actually a cuff. It's 4 muscles that go from your shoulder blade or your scapula, and they go over and attach to the ball portion of your humerus bone, so the bone from your shoulder to your elbow. And the rotator cuff assists with just what it says in the name with rotation. Also helps to kind of raise the arm out to the side, helps to stabilize the shoulder joint, and probably its most important function is it decompresses the humeral head. So like as you're raising your arm up overhead or things like that, basically it acts like a counter pull to keep that ball from riding up too much in the socket, too much to the, upwards and then forwards in the socket. And so a lot of times when people get that just kind of degenerative, either tearing or just irritation, start to develop some tendonitis in there where the tendon becomes inflamed. A lot of times that's because of a weak rotator cuff muscle or muscles, and the ball starts to ride, the humeral head starts to ride up and forwards a little bit. It's called superior humeral migration or humeral head migration. So it just moves up a little bit and it rubs. And it's going to rub and pinch, or you may have heard the term impingement. It's going to impinge the tendons in the joint. It can impinge or pinch the bursa sac, which is a fluid-filled sac inside the shoulder joint. Kind of acts like a cushion. It's called a subacromial bursa. And, so all that stuff can start to get inflamed. And that's where you get this progressive loss of range of motion and just pain. A lot of times you can have pain that radiates down the arm. You may have it come down the elbow. It may go down in the hand. And depending on which of the 4 muscles are involved, then you can, if you know what their pain distribution area is, then you can kind of pinpoint which muscle's the one that's actually, aggravated or torn or whatever, just by where it refers to. It may refer down the outside of the elbow, up to the neck, down to the hand, the fingers, those kind of things. So a lot of times people think they've gotten, and I've even had patients in the past that, initially you thought, man, this is like a tennis elbow or something like that, and shoulder not really bother them that much, and then come to find out on down the road, that just not really getting better, and they have an MRI, and then bam, you've got a rotator cuff tear, that's going on. So So it can be a little tricky initially. You may think you've got some other things going on, and it's not. And so, and again, with a traumatic, is just in its name, it's some sort of traumatic tear. And with that, you usually have an immediate loss of range of motion. You're going to keep the arm into the side and kind of guard it. You're probably not reaching behind your back, like to tuck your shirt in, or put your hand behind your head to wash your hair, things like that. And so you do have the options if you have or suspect a rotator cuff tear. Obviously there's always a surgical intervention, and at times when it's a massive tear, large tear, or it's so complex, maybe you also have a bicep tendon that's torn, or maybe the labrum, which is a kind of this cartilaginous material that kind of holds the joint capsule together down deep, is torn. So it's something more complex like that. It's usually going to require surgery. And then when they do that, if it's a small tear, they do that arthroscopically, where they make these holes, usually maybe 4 arthroscopic portal holes in the shoulder. And then if it's a massive tear, then they usually make a full incision down the front part of the shoulder, like they're doing a shoulder replacement or something like that. So that's the surgical options of partial tearing and full tearing. But a lot of times, if you don't have a tear, it's just inflamed, it's just irritated, you can do some rotator cuff strengthening exercises to try to load that tissue, load the tendons, gradually and progressively, and some stretches and things like that. Although the research doesn't really support the stretches being all that beneficial necessarily, if you just want to maintain some flexibility in the joint space. But that progressive rotator cuff loading is really the most beneficial thing that you can do. I mean, you can do things like massage. You can go have massage and have joint mobilizations, or shoulder manipulations, or cervical spine manipulations, things like that. And you may get some relief with some of that, but again, if you're looking at just research, like what is really going to make a big difference, it's going to have to be those progressive exercises. Even things like ultrasound and things like that don't have a really good history in research of really being super beneficial. I know people that go and have dry needling. Unfortunately, just sticking needles in your tissue is not going to cause a rotator cuff to spontaneously heal and collagen fibers form like they should within that inflamed and irritated tissue. So those are just things that may help modulate or decrease your pain some, just like electrical stim and things like that. They may help decrease your pain, which can allow you to do some exercises, because the exercise is the most important thing when it comes to rotator cuff. So, and I've had patients in my career that we've had partial rotator cuff tears and ended up not even having to have surgery. The doctor goes back and ultrasounds it or repeats an MRI or things like that, and it's like, oh man, this is starting to heal. It's just getting better. And the patient reports less pain, and they have an improvement with range of motion, strength, and kind of a return to function, and they don't need anything else. They say, I don't want to have surgery right now. I think I'm just going to put that off. So, that's, again, I've had that happen a lot in my career. So just because you might have a partial tear or severe tendonitis, or I don't want to say not a large tear, because usually a large tear, you probably want to opt for surgery if you're a candidate. I mean, it's just something to go ahead and fix. With massive tears or large tears, I usually don't see a huge return to maximal function with that, because it just doesn't do well. And especially if the tendon is all the way, kind of cut in two, then you have what's called some retraction, where the tendons pull away from each other, or the tendon pulls away from the bone. And that's not going to just spontaneously go back out there and heal on its own, or at least I've never read anything or been trained that it ever will. So anyway, but at home, something that you can do, there's a couple of tests. And so obviously you can't see me because I'm not videoing this podcast yet. But I'm going to reference some different tests that you can do. You can go online. Obviously, my disclaimer, consult a physician or healthcare provider before you undergo any treatments or testing or anything that we talk about on the podcast. Because obviously I can't see and I don't know your medical history. So, but just keep that in mind. But some tests that are good to determine if you have a tear or not is the drop arm test, which basically is kind of bringing the arm out to the side. You have someone bring it out to the side, and then you see if you can hold it there. And if you can't, and your arm just kind of falls down, or it's very, very difficult to keep there, it's likely that you probably are going to have a rotator cuff tear, especially a supraspinatus tear that runs across the top of the shoulder. So that's one test that you can do. There's a lag test that you can do for the infraspinatus. There is also, I do one that's kind of elbow by the side, and you do like this resisted internal and external rotation to see if one is significantly weaker than the other. And then I always compare to the other side, to make sure that it's just not, you just so happen that you're not weak in one direction or not. But I always try to just compare both sides. I do that test. There's the full can test, the empty can test, the lift off test, which is behind the back. And then there are some impingement tests. Although the impingement tests, I don't really think I don't want to say they're not beneficial, because obviously there's some really smart guys that develop these tests, but you may get false positives sometimes, because if the shoulder joint's really inflamed, if you do a Neer's impingement test or you do a Hawkins-Kennedy, something like that, then you're going to get some pain. It's going to reproduce pain. So, and then I always check the bicep tendon, do what's called a bicep load test, a Jurgensen's test, a Speed's test, and then I would check the labrum. I would do a Clunk test, a Crank test, and an O'Brien's test, and maybe throw in an apprehension. So again, I know I'm just throwing a bunch of names out, but you can just YouTube those honestly, or look those up and see what they are and how to do them. Again, following the disclaimer, and see if maybe you have that going on. So, again, if you think that you do have a rotator cuff tear, you want to have it checked out, of course. But this is just stuff that you're at home and you think maybe this is going to get better. If you do these tests and you start getting a lot of these tests that are positive, you probably should definitely have that looked at, consult an orthopedic. And here's the thing as well, something to keep in mind. The longer, obviously, if you're letting it rock on, and that's costing you time, right? And then you go to the orthopedic, and the steps on that, and a lot of people aren't familiar with how these steps kind of go, and the orthopedic may or may not inject it, which honestly, I'm not a fan of that, especially right away, but they may inject it with a steroid injection or something like that. Probably going to put you on anti-inflammatories, and then going to send you to therapy. And you're, in most cases, they'll do an x-ray up front, which is not going to show soft tissue, dysfunction like a rotator cuff issue, something like that, or a tear. But they're going to do the x-ray, and a lot of insurances want to approve an MRI until you go to therapy, for so many weeks or so many visits, and then it's not improving or something like that, in order to order an MRI. So, and that's not even 100%, right? Like sometimes MRIs don't pick up on things, or sometimes I actually had a patient the other day that thought that the physician thought that they had a rotator cuff tear. He had a tear in the past, years ago, and thought it was torn again based off the MRI, and they get in there and come to find out that it's actually not torn. Just some calcium, a little calcium buildup and stuff, a little scar tissue that he cleaned up, and just because it may show one thing, it's not always 100%. I mean, obviously, it's still better than not being able to look on the inside of the body, but anyway. So that's kind of the thing with the process for the MRI. Just be aware that you're probably not going to get that first. They're going to send you to therapy first. Do I think that's a little backwards? Yeah. I mean, at times, definitely. It's like, you would think you just do the MRI and know what's going on. That way you're not spinning your wheels, or, some therapists, which I think I've been fortunate enough not to make anything worse, but some therapists you may go to that may make things worse, may do too much, and then, then you're really in a bind with it. So, yeah, that's rotator cuff dysfunction or tearing or whatever, you want to call it, just stuff that you may be experiencing. And if you experience that at home, I definitely would have that checked out. Like I said, just because the longer you let it rock on, it's just going to cause you more grief. And then once it really becomes inflamed, you're going to get, or you could get things like calcium deposits and calcification, or, that starts to occur in the tendons, and that has to be cleaned out. So anyway, so thank you so much, guys, for listening. I hope that helps a little bit of understanding of rotator cuff problems and just, how you can check a few things at home. And again, as always, please rate me 5 stars wherever you listen. I do appreciate it. It very much does help me out. And thanks so much for listening, guys. Have a great day. This podcast is brought to you by Guerrero Rehabilitation, setting the bar for rehabilitative and sports medicine care.